Hi, my name is Christina McDuffie. I'm going to do a presentation about antibiotics. I go to the University of Mississippi for women, and I'm in my second semester, which is our spring semester. So let's start with number one. So this is going to be about antibiotics in you. So what I'm really wanting you to learn here is the difference between a bacteria and a virus. Kind of give examples what a bacteria is and what a virus is, how to prevent antibiotic resistance, and what's the benefits of stewardship and what it is. So, what is an antibiotic? Antibiotic is also known as an antimicrobial drug, or drugs that fight infection caused by bacteria in both humans and adults. Don't joke. Antibiotics fight infections either by killing bacteria or making it difficult for the bacteria to grow and multiply. So it kind of hits it at the beginning to where it doesn't multiply, make you sicker, and sometimes if you get it early enough, you don't have such long symptoms. So, what you should know. Oh, no, go back. Okay. Antibiotic resistance is a growing problem in the United States. There's a lot of people that don't know the proper way to use antibiotics and how to dispose of them, how long they should be for, or what they're even used for. Some people go to the doctor and just want antibiotics because they're sick, and that's just not something we should be doing. So a lot of them are being overused and misused, and some are just confused with what a bacteria is and what a virus is, because the antibiotics aren't going to attack a virus. That's going to be a whole different set of treatment for you. So this is just a little thing that shows how antibiotic resistance spreads. Okay, so what a virus is. A virus is the cold, the flu, bronchitis, or it could just be a cough you got going on. It's nothing really considered a bacteria that's caused it. So when you take antibiotics for a viral infection, it's not going to cure the infection. And it's not going to prevent others from catching the illness. So it's kind of like you're taking a placebo the whole time. You're letting the bacteria get resistance to whatever's going on in your body, and then you're going to have more medications to destroy it instead of having the one thing that you need. So, something that is a bacteria, that's strep throat, urinary tract infection, and the whooping cough. So, when you take antibiotics with these three, you would see results with them. You're not over-treating what you think is sick. Like, this is what the antibiotics are for, not for a virus, they're for bacteria. So these will stop the bacteria growth. Hopefully if you get them in early enough, you're not having resistance to them. So when you're taking an antibiotic, when you have a virus, it's going to increase your risk for getting an antibiotic-resistant infection. So you're taking the medicine that you think you're supposed to be taking, but it's not going to kill what you have going on because it's a virus. It works a whole different way than bacteria does. So you're letting your body get used to what the medicine is, so whatever bacteria is in there will start replicating and know what they need to fight off whatever medicine you're giving them. So antibiotics also kill healthy bacteria in the gut, so that could cause even more trouble, like having C. diff, which is common in hospital patients, where you're just having a lot more diarrhea, you're getting dehydrated, you're staying here longer, you can get septic from it. So you're kind of doing yourself worse if you're taking antibiotics when you actually have a virus going on. Antibiotics also cause 1 out of 5 emergency department visits for adverse drug effects. So people just can't take antibiotics and they think that's what they're supposed to do, or they'll ask a friend like, hey, do you got any extra whatever? And they'll be like, yeah, sure, here, take it, finish it off for me. So, let's see here. So, how do bacteria become resistant to antibiotics? So, bacteria can become resistant to antibiotics through several ways. Some bacteria can neutralize an antibiotic by changing it in the way that it makes it harmless. Some bacteria can change their outer structure so the antibiotic has no way to attach the bacteria it's designed to kill. And bacteria can also become resistant through mutation of their genetic material. So bacteria are smarter than we think, and once we give them the power to become resistant to all of our medication, then we're not going to be able to cure anything anymore, or at least dull the illnesses. So after being exposed to antibiotic, one of the bacteria can survive because it found a way to resist the antibiotics. So that's how this whole thing starts. Let's say you didn't finish your Z-Pak. You had 7 days to do it, and you only did like 6 days, you were already feeling better. And there's one little pesky bacteria that stayed. Well, guess what? He knows. He pretty much got the cheat code for your whole bacteria that's in your body, and whenever you take that medicine again, he knows how to fight it and stay longer and tell all of his little friends of how they can stay longer too. So, cute little cereal. So this is how antibiotic resistance occurs. So pretty much you have a high number of bacteria, few of them are resistant to the antibiotics. So the antibiotics kill the bacteria, causing the illness. Then the resistance bacteria now have conditions and grow and take over, and then the bacteria can transfer either their drug resistance to other bacteria or cause more problems. So let's say you have the flu. They gave you a Z-Pak or antibiotic. You took it. It didn't do much good for you, but it did kill off some bacteria. But the ones that are left, I already knew what you gave them, how it worked, how it killed the other ones, and now have figured out a way to survive past it and will stay in you. So, what can you do? You can ask your healthcare professional about what you can do to stop or slow antibiotic resistance. Instead of going to the doctor, you can kind of figure out what you have going on. Like, not go in there and know, hey, I just want a Z-Pak because I don't feel good. You need to actually go in and have the tests run that need to be run. So, or you can ask them if there's steps to take to make you feel better without the use of antibiotics. Like, maybe take some more vitamins or drink some orange juice, or just let the course run its way. You always want to take your antibiotic exactly as prescribed. I mean, if you take it improperly or don't take all that you need, you're going to have leftover bacteria that aren't going to kill off whenever you have the same thing happen to you again. And also, for our older community or even us, you need to talk about getting your right vaccinations, like your pneumonia vaccination, your flu vaccination. That way, people aren't getting sick and think that they need some type of antibiotic to fix everything. You already got your vaccination, you're not getting sick, it's not lasting as long as you want to, and you're feeling better faster. So, what not to do. Don't take an antibiotic for a viral infection, which were colds, flu, sore throat, etc. Never pressure your healthcare professional to prescribe you an antibiotic. Just because you know you're sick, you never should ask them, they know your treatment of care. It's hard for you to go in and just tell them you need this when they don't know what's going on. Don't skip any of your doses. Take all of your antibiotic as prescribed. Don't save antibiotics. Because just because you felt bad and you got better quicker doesn't mean you should just stop. Save antibiotics, pass it around the whole world. If your neighbor down the street's like, oh, I got a UTI, you got any leftover medication? Like, yeah, here, sure, take some of this. Just as many doses as you want to until you feel better. Because then we're making more bacteria resistant. So, types of antibiotic-resistant organisms. So, we know about C. diff. It's a diarrhea superinfection, which can be serious and fatal. So, that's the most common. It's mostly acquired here in the hospital setting. You're killing off all the good bacteria in your gut, so you don't have anything that can fight off the bad bacteria. We also have MRSA. So that's some resistant staph we got going on. And then we have now vancomycin resistant. So now the bacteria are learning how to be resistant to vancomycin, which is one of our strongest antibiotics, because it could be overused, not used, underused, or we're not given the right amount of doses to kill off whatever is going on. Or we're giving it for viruses instead of what we really need to. And then we have CRE, which is another important bacteria-resistant organism. So we have the CDC's come up with this new antibiotic stewardship. So it just means that we're coordinating interventions designed to improve and measure the appropriate use of antibiotic agents. So pretty much what they went around and did was they went and talked to other nurses and other hospitals and was like, why are so many people getting resistance to all these antibiotics? So they have been investigating the length of time that you need to take an antibiotic, the duration of it, the route, like switching people from IV to PO faster, so we're not giving them too much at one time. And then they're also, just shows that if we're doing the stewardship, which is pretty much just us doing what we need to do, making sure everybody's taking their antibiotics right, making sure that everybody's finishing it, not overusing, not abusing it. It's improving our infection cure rates, and then it's improving us not overusing the antibiotics and not prescribing them when we don't need them. And then it also helps reduce the drug reactions, which has showed that 1 out of 5 people come in for adverse drug reactions to the ER after they've been taking antibiotics. So the less that we have to use antibiotics, the better we are with it not becoming resistance. Or if we can figure out how to stop it early, like from giving them too much IV and switching them over to PO, then they know how to take that. They know how many doses they have left. So what can healthcare workers do? So we need to obtain appropriate cultures using proper techniques before the antibiotics are started. We don't need to hang the antibiotics and then go draw blood cultures, because then it just don't make any sense anymore. That's already showing up in their blood. You can use the microlab to help guide what optimal selections of antibiotics. Sometimes with us, they'll kind of pop up with, this is what your blood culture is positive for, and this is what it's sensitive to. So we can always rely on them to tell us what type of antibiotics we need to start, and also tell the doctors what type of antibiotics we need to start. We can help give informed decisions of when to start an antibiotic, especially in septic patients here. We can evaluate the patient's condition, like I said, switching from IV to PO whenever they're waking up more, they're doing better. They can swallow their pills without any difficulty. We're not having to give them so much through their IV over a short period of time. We also need to make sure we're looking at their allergies when they come in. That way we're not giving them anything that they're allergic to or that they've had that's already become a resistance. Like if they had VRE and we're giving them vancomycin. So, final facts. Every time a person takes antibiotics, sensitive bacteria are killed, but resistant ones may be left to grow and multiply. So, like we said earlier, if you're taking an antibiotic and not finishing it, the bacteria is like 1 or 2 just hanging out. They already know what you did to all the other bacteria, so now they know how to stay, like what they need to, like harden their shell or change their DNA, whatever it takes for them to still stay in your body. Overuse of antibiotics is a major cause of increased drug-resistant bacteria. There's just so many people that don't know how to properly take antibiotics. They're older, they think when they get sick they need an antibiotic or they need a shot or something, when it could be they just need some rest, fluids, eat better, change your diet. Or they might have a virus that needs a different type of treatment, a different plan. Let's see. Overuse and misuse threatens the usefulness of important antibiotics. People are becoming resistant to things now, so we can't treat it as long, as well, and they're having to stay here longer. Antibiotic resistance can cause significant suffering for people who have infections that were once easily treated. So, when you used to come in for the cold, here's your Z-Pack, go home, it helped make them feel better, and now they feel worse, they're coming in for more things, or getting septic, it's not killing the bacteria that it needs to be. It's just letting more grow to where we're having an epidemic of bacteria that are resistant to everything we give them. When antibiotics do not work, infections often last longer, they cause severe illness, and require more doctor visits and longer hospital stays. So we have more people come to the hospital, more people stay in for longer periods of time. Some resistant infections can also cause death. So we've seen that here. If people get too septic or we can't find the right antibiotics to kind of help their body fight off what's going on, the next thing we know, we're having to talk about end-of-life care. So, let's see. I think I went way too fast. Okay. So, does anybody have any questions? Who can name me 2 types of bacteria? Like two things like that a bacteria can, like an antibiotic can affect. Strep throat. Strep throat.
Urinary tract.
Okay, so can anybody name a virus?
Bronchitis.
So
RSV.
if you have a virus, are you supposed to take an antibiotic for that?
No.
If if you have the cold, are you supposed to take antibiotic for that?
No.
What about whooping cough? You gonna take an antibiotic for that?
Yep.
Okay. So, what do we need to teach our patients as nurses?
Take all of your antibiotics.
And not to misuse or give away or save for another day whenever you're feeling bad. Pretty much we just need to teach the community to where we're not using so much antibiotics or we're not stringing them along when we get sick and going to the doctor and it's like, hey, just write me a Z-Pack. I mean, it always makes me feel better anyway. So,
Question, you know how when they say something is colonized, is that what that mean? Like, you know how some people get a UTI and they say when they test them, they always have a UTI? Is that kind of the same thing, like, when bacteria kind of hangs around and stay and then they have to get more treatment, you know, or like, because they say it's like always, you know, have you ever heard of people being colonized?
I think that's more like in like the elderly population.
Right, but I wonder if that's what
It's
this.
because they don't get the adequate fluid. They take their bladder and it flushes every time.
Okay.
From my understanding.
I've heard that before,
Sure.
like, you know, so like every time we test them, they're going to have a UTI, you know,
Yeah, like
so
especially if
they're
they got a catheter
colonized.
or if they're being cleaned by someone other than themselves.
Okay.
It's just they're being constantly contaminated.
It's like with like a VRE. You're resistant to it, so it's always going to be there.
yeah,
Yeah.
Yeah.
Okay.
that sounds right. Sounds right to me.